From social skills to social media, school, and relationships, teens say that this phase of life can really take a toll on their mental health.
Cindy Hsu spoke with an outreach program called Beyond the Stigma, whose goal is to reach those who may be struggling and have limited resources to get help.
Tell me some of the things that you learned that really changed things for you.
Sometimes response isn't required for when you're listening to people speak.
I feel like mental health is not really talked about, especially as a Black man. Feels like mental health is old. It's just a stigma.
Sarai Noel and Jameer Morgridge are high school students in Brooklyn.
I also learned how to be a voice, express like it's okay to be mad. It's okay to feel sad. You don't have to hide it.
Being in this program has caused me to slow down and take a breath.
They participated in a summer peer-to-peer outreach and counseling program through the Arthur Ashe Institute for Urban Health. Teens learn vital communication skills, take part in workshops surrounding mental health, and learn valuable resources for help.
How much did you know about mental health before you went to a program?
I basically knew nothing. In school, it's something that's breezed over.
We always skip past it.
They're also taught to be alert for red flags.
Sometimes people just give away their things.
They're willing to more stay inside, cut off their phone.
Statistics around teen mental health highlight the need for programs like these, with as many as 1 in 3 high school students reporting their mental health was not good most or all of the time.
They can actually not only help their peers, they could help adults in their lives too, in terms of providing them with those same resources.
Dr. Marilyn Fraser is CEO at the Ashe Institute.
And at the end of the program, these young people are transformed.
Talk about the accessibility of this kind of knowledge in the community.
People may not know where to find those resources. We are also in communities where people do not like talking about mental health, and there's a lot of stigma associated with that.
All we talk about these days, it seems to be AI and social media. What kind of change or challenge do you see there?
It takes us so much more in terms of effort to have them break free from that space. And that comes with talking to them, understanding what is going on, understanding some of the challenges.
Through this program, these teens have reduced their own social media use, and both say they plan to stay the course in mental health studies.
I feel like this program really helped me to that, finding my passion in psychology and social science.
These are people in our community. It's something that we need to learn now because it's not going to get easier as we get older.
And Cindy has done many stories breaking the stigma on mental health issues. For a look back at our coverage, head to cbsnewyork.com.